Hello, everyone. Welcome to Go Campus. This is Ashwini with you. So, this podcast is aimed at doctors who are considering international careers. Today, I'm very happy to have Dr. Aashish Raghu, an orthopedic spine surgeon who has trained and worked across India, the NHS, and the UAE. We are going to have an interesting conversation about what global surgical careers really look like. So, very warm welcome to you, Doctor. Thank you so much for taking time to be with us here today.
Thank you very much, Ms. Ashwini. Thank you for your kind introduction. I've been looking forward to this conversation. So, just a brief intro about myself for everyone watching. I am basically a practicing orthopedic spine surgeon. I completed my MS Orthopaedics from the Government Medical College in Jabalpur in 2015. I then worked as an assistant professor at Vaidehi Medical College in Bangalore, and then further moved to the UK for training. I spent about 6 years in the NHS, including 5 years as a trauma and orthopedic specialty registrar, and then later on 1 year senior spinal fellowship at the East and North Hertfordshire NHS Trust. I currently practice my specialty in Abu Dhabi, UAE.
Thank you so much for that, Doctor. That was a very
Thank you.
detailed intro. Doctor, I'm sure everyone listening to this podcast will be curious to know, was there a specific moment or a trigger during your training in India or after your training in India that made you think you have to look beyond India?
So there were a few things. One thing was I worked in sort of busy trust hospitals and the government hospitals. And I think we had a very good exposure to surgical load, but I feel at some point of time I required a bit more hands-on in terms of knowing the right way to do things, because there are different ways to skin a cat. But in order to actually follow what's safe and what's up to date, that's something that I felt I lacked during my training in India. When I started working, I had to go back to the same principles that I was taught during my training. And the other reason was, I think there was not much of scope in India to further specialize, because it's still a very generalist practice in India. And I wanted to subspecialize in spine, which I was quite interested in from before. And I knew that in UK, everything is very subspecialty focused. So I decided to go and take that route to further specialize.
So, Doctor, in India also after MS, doctors do MCH, right? So in MCH, we don't have subspecialty that you've done in the UK.
In my time, I think there was no dedicated spinal fellowship in India that focused on what I needed to learn. So I decided to explore what avenues UK would give me.
So let's say, because I'm sure we will have MBBS doctors watching this podcast, and I'm sure even orthopedic surgeons from India or doctors who are still in training will be watching this podcast. So just to make things a bit more easier for them, for an Indian MS orthopedics graduate, what does the UK pathway actually look like in real life? Are there multiple pathways for them? Or even if there are multiple pathways, how does one choose that this is the best pathway for me?
I think there's a very important question that everyone needs the answers for. And unfortunately, I was not very exposed to this when I made my journey there. But yes, for an Indian MS Orthopaedics graduate, basically your MS degree is not really recognized in the UK other than your MBBS. So your MBBS gets verified by ECFMG. You go in there and they just look at your experience as an orthopedician wherever you were before. So the different routes that you can do, I'll go with the current trends. So the current trends are people going in just purely for a short fellowship. Not really short fellowship, but fellowship for about 1 to 2 years. So that's a fellowship route. The second route is sort of service-based non-training route. And the third route, which is the most competitive, is the specialty training route, or the ST route. So many surgeons enter the UK through the international training fellowships without needing to do any UK exams to get the GMC registration. So because it's automatically sponsored by the GMC to do a fellowship. So in some structured programs like in Wrightington Hospital Trust, the training period can cover up to 2 years, and then you can get the MCH qualification at the end. You get to publish papers and you have subspecialty exposure during the second year. The second route is what I did. It's a sort of trust grade clinical fellow route. Here, the most realistic starting point for most people, you can join the NHS in a non-training role. You work in a middle grade level, build good UK experience, add your cases to your logbook, do audits, and you do get opportunities to publish literature, which I wanted to do as well. But stay on this long-term path, and they do quite well. Some of them do progress to consultant roles via the portfolio pathway, previously known as the CESR pathway. So this portfolio pathway is, you don't really enter a formal training program, but you can become equivalent to a UK trained consultant at the end. and enter into the GMC specialty register. So it's a more of self-directed training to achieve similar competency to sort of formal deanery trained candidate in the UK. It's quite documented. You need an average of 5 to 6 years of focused preparation to collect the required evidence. Can feel very demanding, and most people do lose motivation during this process, but it is completely achievable with proper planning and consistency. So coming to the specialty training route, as I said, is the most competitive, and it's also quite it's the least predictable for an international graduate coming to the UK for the first time, especially in the current climate where the priority is towards the local UK graduates. It is still possible to do, but you shouldn't build your entire plan around it. Keep it as a sort of you need to have your plan B and plan C and so forth.
So you repeated your training, doctor? You started from ST3 in the UK?
So no, I did not do my training route there. I went for the clinical fellow non-training route. I worked as just as a registrar, service-based. I was rotating through various specialties every 6 months. So I got my adequate subspecialty exposure. It was quite a busy hospital trust. And I rotated through spinal surgery as well for 6 months during that time. And that's when I realized that spinal services in this hospital are quite good, and I would like to do my fellowship further in this place.
When you went to UK, what was harder than you expected when you entered the NHS system? Because we've come across certain doctors from India who've done MS, who've gone there, but for whatever reason, they just returned in 2, 3 years. They didn't want to continue it further because they're already postgraduates here. They had different experiences and different reasons to get back. So did you find something harder? You didn't find the system in the beginning?
Yes, I think that's a really important observation. So basically, for me, my reason initially was that it was very challenging to get used to the system, maybe for the first 6 months, as is for most people. I was already working as a consultant in India and then moving to a registrar level position in the NHS. It required a big shift of mindset and expectations, especially when you're busy in a busy teaching hospital. It means you're doing long day and night on calls. You're staying awake through the night, and you have to you have to do very detailed documentation, and you have to practice within a very defensive governance driven system. So that can take getting used to and can feel very stressful, especially when it's busy. At the same time, there are a lot of positives, like you learn about how to work within a medical team. You do shared decision making with patients, open case discussions with consultants, multidisciplinary input, and you always constantly engaged with current evidence, which is something that I was looking forward to. So you're basically encouraged to question, reflect, which can improve your patient care. While workload and pressures are quite high when compared to my experience in India, the system actually shapes you into a more thoughtful, structured surgeon. Looking back now, the adjustment was quite difficult, but it was quite transformative. So the reasons why I feel some people do return is because maybe they aim for getting training and they don't get that, and they're somewhat have to continue their service-based jobs, and it tends to be too busy. In India, it's that as you climb the ladder, your work reduces, but in the UK, as you go up, your work and the stress just keeps increasing, and as a consultant, the responsibility is quite high. So some people don't like that stress, and they want a comfortable life after going through the grueling process. And I think other people have possible commitments in India. They feel that they get more help because you do get house help and all of this back home, compared to the UK, where you have to do everything on your own. There's no one to help you.
So, doctor, now we come across many doctors. Understanding PLAB pathway has become very difficult. So, we tell all the doctors to add MRCS to their profile. And also, we meet many MS orthopedic doctors who are looking forward to move to UK. So then we tell them, no, it's better that you start writing MRCS exams, do MRCS, and then apply for jobs. So you increase your chances to get a job. But for some reason, this fear is there. They feel MRCS and the FRCS are often spoken about with fear. They're like, can we pass? Is it really doable and all? So from your experience, what do candidates overestimate? Are these exams really that difficult? Can you give us some inputs on it?
So I think I had the same notion before doing my MRCS. I was quite worried. Everyone said it's so different and something that we are not really used to doing in India, because the exams in India are basically memory based, rote memorization. You have to just basically do multiple choice questions or answer long questions. But in these UK exams, basically test your higher order thinking. They see how you approach a case and what reasonable diagnostics you can do to achieve, and make a decision for patient care. Doing the MRCS immediately puts you in a spot to get a registrar job in the UK. While if you do a PLAB the PLAB exam, you enter in much junior to that, maybe as an F1 or F2 level. So I decided that the MRCS is a better way to go because I was practicing orthopedic surgeon at that time, and doing a surgical exam would kind of complement that rather than doing a PLAB exam, which is more a junior exam. So the biggest misunderstanding is people think MRCS and FRCS are intelligence or trick exams, intelligence-based or trick exams, but they're not. So as I said, MRCS is sort of a junior exam. You enter into the UK, you get to practice within your surgical specialty of your choice. It's quite straightforward. There are two parts. You have the MCQ exam, you have the OSCE exam, and this is what most people are scared about because we didn't have this sort of exams in India where you have to do take history taking separately with one patient. You have to do examinations. There's suturing station and all of that. This is something that we were not examined in India specifically. But the JCIE FRCS, which is done in the UK, is a consultant qualification exam for the trainees there to become a consultant. And this basically tests your higher order thinking, how you make decisions when you're under pressure as a day one consultant in the UK. So examiners are basically looking for your safe clinical judgment, the ability to prioritize cases and make calm decisions. The other myth is that you feel you need to know everything for the exam, and that's not the case because most people who do fail the exams are usually due to poor preparation, communication, or unsafe answers, not lack of knowledge as such.
True. I think this is what we advise because currently I think many doctors are a little not in the right mindset after knowing about the prioritization bill. They're upset because they've invested already 1.5, 2 years time in the PLAB journey. And we are seeing a couple of doctors who've got membership exams on the profile are still getting jobs. Of course, they're starting with the non-training jobs, but at least you're progressing in the career because we see even in India, the membership qualifications are highly valued. So we tell all the doctors as much as possible, keep progressing on the CV and keep adding the membership exams to your CV till things get better. And I think trying for jobs that keeps happening.
I think that's good advice because you don't lose anything by doing these exams. You're adding a qualification to your CV. And even if you don't get a training job in the UK, it's not the end of the world because you are still working in your surgical unit. You are being trained continuously by consultants and you are being assessed by them as well. And every day you are put under pressure to make decisions, even as a registrar, because you have to deal with managing the on-call patients alone, preparation for theater. The consultants keep grilling you on what kind of preparation you've done for the cases on the for today. Do you know what approaches we use and what kind of procedure to do? So at the end of the day, you still learn something, and it's almost the same learning as the specialty trainee. The only thing is that it's all self-directed as a non-trainee. You have to have the motivation to go forward, to think about whether you want to be a consultant in the UK and then work towards your portfolio pathway, which is, as I said, can take about 5 to 6 years of focused preparation.
And doctor, now that you worked, of course, you were already worked in UK and now you're currently working in Abu Dhabi. So how do the systems differ for surgeons? And why did you make the decision of moving from UK to UAE?
So I think it has to do with the health system focus. In the UK, it's more of public healthcare, NHS, and there the focus is mainly on evidence-based practice, doing what's best for the patient based on current evidence, where the government actually supports you. And the positives are that you know your guidelines, you know how to make safe decisions. And the downsides are it can be very busy in a public hospital and it can, make it quite hectic day to day. In the Middle East, the focus is very much private practice. There are government hospitals, but it's not very easy to get in as sort of a new entry into the UAE. You get into the private sector and you are kind of left to make your decisions on your own. You don't have an MDT meeting. You don't really discuss with consultants as such in most places. So there's no further learning as such in UAE unless you're a trainee there. But getting into training in UAE is mainly focused on the local graduates, and there are less doors open for the international graduates, to my knowledge. So that's basically how the service is. It's more focused on further training and sort of evidence-based practice in the UK compared to your private practice, where you make the decisions based on what you know and take it forward.
Now, we've heard from a couple of doctors, like in UAE, The practice is almost like India. There is no work-life balance like how you see in Western countries. Is that true?
So I feel UAE does offer very similar medical environment compared to India. The practice is almost the same in private hospitals. Work-life balance is definitely better than in India, because in India you're expected to be available all the time to patients and your colleagues, especially when you're doing private practice. But in UAE we do have strict labor laws. You do about 48 hours a week, and you don't follow up on anything after you've left your work and gone back home. And private practice, you're basically in your OPD, you're seeing patients, you make decisions, you operate whom you feel needs surgery. So it is very similar to the Indian place of work, but I think it's less hectic. It's you do have time for yourself compared to India, where you mostly have to be available all.
Now, let's say we do have many Indian surgeons who may not want to do a long training pathway in UK or in Western countries because our degree is not directly recognized. So most of them do repeat, and some of them will explore, like as you said, either CESR or specialist pathways in different countries. So currently, many doctors do see Middle East as an easier option. But we also understand even in Middle East it's become quite competitive now to get the first job. So in your experience, because you're currently there, how realistic is this perception today? Is it really easy to get a job in Middle East?
So, yes, to answer that question, it used to be easy to get jobs in the Middle East earlier, because there were not too many local graduates getting into the field, especially to staff hospitals. And it was not well known at the time about the pros and cons of working in the UAE. But right now, you can't get a job by just being available, like in the past, because now most of the Western trained doctors as well from tier one countries, they want to come in and work here as well. So now UAE has a very big recruitment boom. They tend to look forward to people who are more, who are trained from tier one countries, mainly for consultant level. And it is quite competitive because everything here is network based. Even to get a job, you need to have someone to recommend you to the HR and promote you there. And that's when they get a sea of applications for one job, probably about hundreds for one job. And to come in the front of the line, you need someone to recommend you. It's all based on network.
That's quite difficult because we do have many doctors reaching out to us saying, I've passed DHA or I've passed MOH or I've passed other licensing exams, but they are taking quite a long time to find the first break or to get the first job in UAE.
Yes, that's right. It's extremely challenging now to easily get your first job. You're lucky if you get interviews as well, because there are so many people applying, and they always, especially in private practice, they tend to choose those doctors who can sell their profile, attract patients, have a good background. And definitely, Indian training is really good. Everything is great, but they're now, I think, trying to focus more on people who are trained from tier one countries to do the same job. And compared to back home, we have so many doctors and surgeons waiting to get jobs. And unless you have some contacts, it's difficult to get through.
Doctor, understanding that you were already an orthopedic surgeon in India, was there ever a point during your MRCS, FRCS, all this journey that you had, where you genuinely thought that leaving India was a mistake? Did you ever wish you'd continue to practice in India itself? And whenever you got this feeling, what helped you really push through and achieve and come this far?
So I think it was the motivation to learn more and fine tune my skills that pushed me to go abroad. Regarding mistake, I used to feel at times that it is just quite challenging to adjust to the system and doing a middle grade job after I've been sort of senior in India already. That was quite challenging to adjust to. I never felt it was a mistake. I just felt it was quite challenging. Looking at other people, most people sometimes chase a quick escape abroad. They just, instead of building the readiness to adapt to a future requirement. So most doctors are not clear about what they ultimately want. They rush towards a country that feels easier to enter into. And then later they realize their long-term goals don't really align with the system there. And some also underestimate system differences or rush through exams without a clear endpoint. So the doctors who actually do well are those who clarify their goals early and understand what kind of system they're entering, the long-term pathways available to become a consultant there, and align their training and exams and experiences accordingly.
Thank you, doctor. So, if you're watching this podcast and if you're a surgeon and you're exploring career options in UK or UAE, now you know whom to go to. You can certainly book one-on-one mentorship session with Dr. Aashish Raghu. The slots will be open. So, if in case when you log in, if you don't see any open slots, that means all the slots are already booked. You can still click on the notify me button over there. Then we will immediately get in touch with doctor and we'll make sure that you will get a chance to speak to Doctor one on one to understand what should be your journey ahead or path ahead. So, thank you. So, Doctor, if a young
Sure.
orthopedic surgeon is listening today, confused, overwhelmed, and worried about making the wrong move, because we understand currently all countries have become equally competitive, equally challenging. So, what is that one thing you want them to hear from someone like you who's walked this path before?
Yes, thanks, Ms. Ashwini. I think it's an important question again. So, this was something that I did not follow myself, but looking retrospectively now, I think everyone needs to know this. It's probably a good pathway that you can follow. You basically have to think about your short term, medium term, and long term goals initially. You should first ask yourself, 5 years from now, where do I actually see myself? Do I want to be in India, or do I want to stay abroad and work as a consultant there? Or do I want to ultimately go to the Middle East after completing something in tier one countries and going there? So once you have a long term goal, then you can work backwards. Start thinking of what are the immediate goals I need to achieve before I reach a consultant level position probably in the UK or the Middle East, and then start taking small steps to achieve each goal. There's no rushing. It's not a rat race. Your life is based on your decisions and your choices that you make. So once you have this kind of approach, you start getting more clarity on what to achieve, and don't do unnecessary things that don't get you anything important. So an overseas career is not just a leap of faith. It's a series of deliberate, well-timed moves. And if you stay consistent, patient, and aligned with your end goal, your clarity keeps following and the right doors open at the right time. So I think this approach is important to hold on to continuously. Even if things seem rough and challenging, if you have your long term goal, you will know how to achieve it step by step.
Okay, doctor, that was really nice. And just that one last question before we close, because we understand surgical careers are very, very competitive. Like we see a kind of reverse trend in India. In India, radio, dermat, medicine, these are medicine subjects are more competitive. But we see internationally surgical careers are very competitive, and having the strongest CV is very, very important. So can you tell our doctors what should be there on the CV or on the portfolio if they're looking for global careers?
Yes. I think initially during my time, everyone wanted to take orthopedics, general surgery, because it provided a good scope, especially when you're doing private practice. But right now, people are looking more for quality of life, because now people have realized that surgical specialties means you're always on your toes, you're always busy, and you don't get much time to spend with your family, especially when you're doing multiple jobs in a day. So to get on your CV to further your career, I think it's important to do what you want at the end of the day. You have to focus on some specialty these days. We can't, most of the time, people think doing general medicine, general surgery ends the game there. But nowadays, people are going towards the Western concept of subspecialty and just creating your niche where you focus on throughout your career. And you make your name that way. Once you're known of being, working as gastroenterologist, for example, good one, providing good service, you become popular that way, and then your workload reduces to some extent. Focus on subspecialty training in terms of you can go forward with DM, MCH. Try to do short fellowships if you don't get into this MCH or DM route. And you need to show your niche. Do something that is very focused and not general, and keep improving on that. So I think probably one or two fellowships would be good. You can do exams from like the Royal College exams from the UK. It can add on a nice flavor to your CV. But at the end of the day, it's your performance, the way you treat your patients, the way you convince them and clear all their doubts and perform safe surgery. That's what matters at the end of the day. These qualifications will just help you probably get into a good job. But at the end of the day, it's how you are with your colleagues and patients that matter.
Apart from this, anything on research, publication, audit, all these are required?
It depends on where you want to work. If you are focusing on private practice, it doesn't really matter because there's no one to, credit you on that. But if you want to work in a teaching hospital, this is quite important. You need to have publications. You need to have presentations, audits. All of this is very important, especially when you're working in the UK, aiming towards a consultant level job. So it's more for government and teaching hospitals where this is important rather than private practice.
Got it. So, doctor, understanding that you worked both in UK and Abu Dhabi, which country is more financially rewarding in terms of take-home pay and savings potential?
So I think that's a very important question for people moving abroad these days. Everyone wants to know how much they get back after investing in the journey. So in my experience, I think the UK is slightly harder to make good savings unless your spouse is working as well, because things are quite expensive there compared to the UAE. Rent for your house, for a two-bedroom house, and everything is sort of taxed, you can say, which at the end of the day gives you very little to take home, especially when you have high income tax of about 40% compared to zero income tax in the UAE. And I think at the end of the day, UAE is definitely much better. You earn about maybe 2 to 3 times or much more than what you get in the UK. And that's definitely better for your savings. And the only thing about the UAE is job security, because it's all private practice based. So most people come in, try to earn as much and maybe return home or go somewhere else. In the UK, you sort of enter the NHS system, and most of the time you progress well and stay in the system. So job security is good, but the money, I think the earnings are not as good as what you get in the UAE. So short term, say if you want to make short term gains from one place and you want to leave, UAE is better place.
Doctor, now, is your pay in UAE better? Because your pathway is India to UK, UK to UAE, right? So, I mean, you were in a better position to negotiate higher salary because you go with British experience, or it's all the same for everyone based on experience, based on number of years of experience?
Yes, I think there are both of them are right. The years of experience matter. They tend to give lesser salaries to those who freshly pass exams, the MS or MD exams, and come to the UAE. And the Western or the Tier 1 experience and qualifications definitely matters, because you are at a higher negotiating pedestal. And they also know that since you have Tier 1 qualifications or experience, you will be more highly sought after than someone with MD or MS from India, because there are so many people with the same qualifications.
True.
And there are not too many people who come in with Western experience, and that narrows down your competition, and especially puts you at a higher footstool to negotiate.
Thank you, Doctor. It was really an interesting conversation. I guess we touched almost all the points or all the doubts that young graduates or young surgeons will have in mind when it comes to moving or when it comes to think about global medical careers. So thank you so much for your time. This for all the listeners. If you wish to talk to Doctor one-on-one, you have to go to GooCampusWorld.com, search for Dr. Aashish Raghu, and then book a one-on-one session with Doctor to have an in-person conversation on how opportunities are like in this country. So whatever you wish to speak in terms of your career decision making, you can certainly touch base with Doctor. So you'll have to find Doctor on GoCampusWorld.com. Thank you to everyone for being with us. And thank you again, Doctor. It was wonderful having you.
Thank you very much. It was my pleasure.